Welcome back. In today's video, we are going to discuss clinical applications for methylene blue. If you saw the last video, the live stream, it cut out on the adverse effects. So I will put a link below in the show notes and somewhere up here to get you to the first part of this presentation. But let's get into the rest of today's content. I'm going to go a little bit rapid fire here due to the interest in time here. So you can certainly pause on any one of these slides to get further information. This is going to be a little bit rather uncut, just kind of redoing the live performance. So this is where we're at. Methylene blue may cause serious or fatal serotonergic syndrome when used in combination with serotonergic drugs and opioids. Avoid concomitant use with methylene blue with SSRIs, that's selective serotonin reuptake inhibitors. So those are your medications like your fluoxetine would be a common pharmaceutical that would be an SSRI, or the serotonin norepinephrine uptake inhibitors, that's your SNRIs. An example of SNRIs are your desvenlafaxine, your duloxetine, and venlafaxine are just a couple of examples of SNRIs. So just to be aware of that. So again, check with your doctor, check with your provider, of course, before starting any type of prescription medication. Some MAOI inhibitor drugs, again, where extreme caution should be of concern. I just listed the 4 common MAOI drug inhibitors: isocarboxide, phenelzine, selegiline, and tranylcypromine. So be aware if you're on these medications. You obviously want to let your doctor know if you're going to be considering taking methylene blue. Be aware of that. Another warning and precaution is patients with glucose 6-phosphate dehydrogenase deficiency. That is a mouthful, the G6PD. If you have this genetic SNP, you do not want to take methylene blue, in my opinion. It says the antioxidant effect of methylene blue is dependent on G6PD. And so what can result is hemolytic anemia. What are the symptoms of that? As they're listed here on the slide: fever, weakness, confusion, dark colored urine. So be aware of this, of course. I myself personally went to my physician, and that's a simple blood test that you can have done and see if you have this genetic deficiency. This is more common in men, but I encourage you to work with your physician. And again, the prudent thing to do would be, before starting methylene blue, get this simple blood test done. Take-home point. Take-home point number 1 was discussed in the online video, but here it is. Write this down or let this soak in to your CNS. Methylene blue effects are not determined by the standard concept of a drug receptor pharmacology. What do I mean by this? Methylene blue is interfacing. There's a lot of actions here, but what I want you to take home, methylene blue is really interfacing with mitochondria. Mitochondria are all over the body, in every cell. Essentially every cell in our body has mitochondria. So methylene blue is interfacing in that regard. And so that's how methylene blue really can have a lot of diverse benefits, from skin to depression. All right, let's get into methylene blue for these health conditions. So methylene blue to improve memory. This is talked a lot about online. This is talked a little bit about in the literature and some of the studies I've looked at. But neurons are highly specialized cells that require a lot of energy. Somewhere up to about 20% of our calories are spent on fueling the neurons, fueling our brain with energy. And so we have a lot of mitochondria in our neurons. And so methylene blue is going to be attracted to these mitochondria that are in these highly consuming cells for energy. Research has shown that impaired neural mitochondria is associated with memory impairment. Makes sense. If you've got a nervous system that doesn't have a functioning engine in it, the mitochondria, well, of course, I would think common sense would tell us that, yeah, the memory's not going to work that well if the engine to create that memory isn't working, if it's impaired in any capacity. Research has shown that neural mitochondrial dysfunction is observed with neurodegenerative diseases such as Alzheimer's. So again, kind of makes sense there, doesn't it? Follow the trail. There is not a lot of great studies that are done with methylene blue in memory in humans that I could really find, but there's this interesting study that was done in rats. This was just 1 milligram per kilo on, again, this is USP grade, so United States Pharmacopoeia grade methylene blue. So don't confuse this with commercial grade methylene blue, because there's conflicting information out there describing the memory benefits of methylene blue. If you have methylene blue that's contaminated with heavy metals, you can actually, in my opinion, and you're looking at research, impair memory, not enhance it. So again, these rats essentially were able to, with a dose of methylene blue, perform the maze more effectively, and the researchers concluded that was because it enhanced their memory. Alzheimer's disease. Alzheimer's disease, so we get these tau proteins and these amyloid beta plaques. Basically, the way I think of it, it's a bunch of proteins that are clogging up the electrical system of our brain. So tau-like fragments impair cytochrome oxidase activity. Again, I talked about this in the live presentation on how methylene blue improves cytochrome oxidase activity. So there we go. Follow the line here. Follow the logic. Figure out the root cause of the problem, and where Alzheimer's disease has an issue with cytochrome oxidase because of the tau fragments interfering. We've got methylene blue that could, again, get to the source of the problem. Amyloid beta plaques decrease cytochrome oxidase activity and energy production. Cytochrome oxidase is the last enzyme of the mitochondrial energy chain production. So if we can, even if the first 3-4 cylinders, as I call them, of the engine, of the mitochondrial engine, start to fail, methylene blue can come in and basically jumpstart the last enzyme of the engine, the last piston, so to speak, and at least get energy coming out of that neuronal cell again. Increases in brain cytochrome oxidase have been shown to increase after administration of methylene blue. I'm going to say that one more time. Increases in brain cytochrome oxidase activity have been shown to increase after administration of methylene blue. So again, we are getting the engine of the cell up and running in the brain. And again, more studies are needed to evaluate proper dosing and so on and so forth. Neuron protection against optic neuropathy. This is so interesting to me, but I'm just going to read this here. Mouse model of retinal optic neuropathy. Methylene blue effectively prevented retinal damage induced by, this is a known toxin, neurotoxin of rotenone. Rotenone is an inhibitor of mitochondrial complex 1. So think of it as, again, piston 1 going out. It's failing. Rotenone is a known environmental toxin. It's used as a pesticide, herbicide, and so forth, or it was. It induces oxidative stress and energy depletion. You can see where methylene blue comes in here. Rotenone is used, again, I mentioned this already, broad spectrum insecticide, pesticide. Luckily, the EPA has been canceling this use out since 2007, from what I could find. But are people still, suffering the effects of this insecticide? Something to consider, something to look at. The neurotoxic effects of this pesticide has been implicated in the pathogenesis of Parkinson's disease. So if you're out there and you're watching this and you've had exposure to this rotenone, something to talk to your doctor about, in my opinion. Methylene blue. Methylene blue in ischemic brain injury. So we're basically talking about strokes. Every 40 seconds in the U.S., a person suffers a stroke. Now, I just combine those numbers with ischemic and hemorrhagic. Most strokes are ischemic, resulting in the blockage of a cerebral artery. Of course, as logic would follow, you're going to have a depletion of oxygen to the brain. The ischemic region undergoes rapid cell death. Surrounding area deals with energy failure. inflammation ensues, and again, more cell death, more brain damage essentially is what's going on. We need oxygen to run. We all know that. And so when you block oxygen flow, we're going to get cell death. Electrons escape the electron transport train. Basically, all hell breaks loose, generating reactive oxygen species. ROSs are essentially clogging up the whole system where that ischemic clot has formed in the brain. The ROSs damage mitochondria and other cellular components. So again, you can probably see the application here. The problem, though, right, when we have a ischemic or a stroke, let's just put it plainly, how are you going to get methylene blue in that patient right away? So there's, again, a lot to think about here from a utilization standpoint, but it'd be nice if we can get methylene blue basically for high-risk patients or just even mild to moderate risk patients that might be predisposed to potentially a stroke, or they've already had a history of a stroke. Maybe it's worth having some type of system involved where methylene blue might be able to be administered. So, food for thought there. Let's see here. Let's go on to, all right, it says methylene blue has been shown to be neuroprotective in several ischemic animal models. The mechanism of methylene blue in stroke models was increasing oxygen uptake, 2, improving complex 4 activity. So again, getting the pistons of these mitochondrial energy-producing cells, organelles, up and running, and the end result is we're getting more ATP. We're getting energy back into the system, or out of the system, I should say. Other studies have shown that methylene blue can actually reduce infarct size and help manage it. So again, much more research needs to be done on this in my opinion, but it looks very promising. Methylene blue in Parkinson's disease. So in my opinion, again, if you have been diagnosed with Parkinson's, I highly encourage you to talk to your provider about this. Typical treatment consists of dopamine precursor drugs called levodopa. Levodopa is palliative. It does not slow progression of Parkinson's, according to the literature. Parkinson's is the hallmark biomarker for Parkinson's is the presence of Lewy bodies. Lewy bodies are proteins that disrupt further protein function, which ultimately leads to, you guessed it, mitochondrial dysfunction in the brain. These asins, which are a protein essentially, I call them a crappy protein, travel inside the mitochondria, disrupt the pistons again, the energy producing enzymes, complex 1 and complex 4 are essentially taken out by these Lewy body produced proteins. So the addition of methylene blue to current levodopa drug therapy may provide added benefit. Huge caution here though. Due to methylene blue's MAOI, monoamine oxidase inhibitory effects, the combination of methylene blue and levodopa needs to be carefully considered by your provider. So I can't stress that enough. Switching gears, methylene blue in depression. 15 milligrams a day of methylene blue along with amitriptyline was looked at versus placebo. This was a smaller study, 35 female patients. This study, I believe, was done back in, I'd say 1980s, 1986, something to that nature. End result was that it was statistically superior than placebo. Again, this was only at 15 milligrams a day, super low dose of methylene blue. But again, something to consider. All right, methylene blue for dermatological conditions. So this lady might have taken a little bit too much methylene blue, but that is reversible. Methylene blue and energy from light, so we're talking about photodynamic therapy here, and oxygen creates reactive oxygen that is taken up inside of the skin cells into the dermis along with methylene blue. Methylene blue exerts its effects by generating the formation of singlet oxygen. So methylene blue has been looked at for acne, plaque psoriasis, acne inversa, itching, pruritus. So again, a lot of utility here for methylene blue. So methylene blue, been researched for anti-aging of skin. Methylene blue protects the skin from oxidative stress. So it's that antioxidant effect that we're seeing there with methylene blue. Lyme disease and co-infection. So we at our pharmacy deal with a lot of patients that are struggling with chronic Lyme infection and co-infections, and a lot of times you get these dormant infections, these spirochetes that just kind of, the way I think of it, just burrow into tissues and just sit there and cause like a low-grade inflammation effect that doesn't really spike a fever or anything with this infection, but it just makes the inflammatory system a little bit ticked off and aggravates it. So anyways, about 20% of patients can experience chronic symptoms despite traditional antibiotic therapy for Lyme treatment. And so here's where methylene blue might be able to come in and again work as that antiparasitic product or antiparasitic drug and provide some relief possibly for patients. And then methylene blue has been looked at for the recent viral infections that have been floating around since 2020. I'm not going to get into that today. That's out of the scope of what I want to talk about, but just know that that is out there. So how can methylene blue have all of these different benefits to unseemingly different diseases and conditions? If you want to get to know more information about methylene blue, I encourage you to look at the YouTube video, the live stream that I did last week, and I'll put a link right over here.